Hi, my name is Wowczuk, and I'm a board certified pharmacotherapy specialist. I work at West Virginia University as a service assistant professor, and I'm also director of an organization called Rational Drug Therapy Program, where my staff manages clinical prior authorizations and prospective drug utilization reviews. My journey to board certification began with a strong desire to expand my clinical knowledge and develop skills that would make me a better pharmacist. About 12 years after I graduated pharmacy school, I'd felt my career had hit a plateau. And with the ever evolving landscape of pharmacy, I wanted to re educate myself so that my clinical knowledge stayed current. While at that time it hadn't been that long since I was in school, I found myself noticing that the treatment landscape had significantly changed from when I graduated. Even for common conditions like HIV and diabetes, many of the medications that I learned about as first line treatments had since been replaced by newer, more effective options. So I was completing CE courses, I was attending conferences, and I just felt that I wasn't getting the deep foundational expertise that I craved. I hadn't completed a residency after graduation, and for me at that time in my career, it just wasn't the right path for me. I had gained a lot of valuable experience in community pharmacy for several years, and then I had backed that up with 7 years of managed care pharmacy. And although I really loved my job, I was itching for something to challenge me and sharpen my clinical skills. I decided at that time to set my sights on obtaining my board certification in pharmacotherapy, and I thought that that would be the best path for me to achieve my professional goals. And my goals were clear. I wanted to elevate myself professionally, I wanted to establish credibility as an expert among my peers, and I wanted to boost my confidence as a clinician. Since earning my BCPS in 2019, my career has taken significant strides. Board certification paved the way for me to join the faculty at the university where I now get to teach and I get to mentor students as they embark on their professional journeys. And that's been very personally fulfilling to me. At least in my experience, breaking into academia without a residency is somewhat atypical. And I'm truly thankful for my board certification as I do feel it opened this door for me and it allowed me to grow professionally. And beyond even my direct career advancements, our organization, Rational Drug, has also secured grant funding to focus on critical healthcare issues, such as pediatric mental health, specifically ADHD, chronic opioid use for pain, opioid use disorder, and other substance use disorder. And these are all pressing concerns for the state of West Virginia, where I was born, raised, and currently practice. Contributing to these initiatives just really filled me with a lot of job satisfaction. And I really enjoy knowing that my work has such a meaningful impact on the public health within my home state. As pharmacists, we have a natural affinity for lifelong learning. There's no question about that. But getting my BCPS really made me feel like I had grown as a clinician in a practice setting that I loved and enjoyed, and it increased my job satisfaction. After we graduate and are in practice for a few years, there's not a whole lot of ways we can get the career boost that we might be craving. We might feel stagnant and unsure of how to move our career forward. And if this sounds familiar to anyone, I know it certainly was my mindset at that time. I was a candidate who was no longer considered fresh out of school, but also I'd gained a lot of valuable work experience. And I was unsure about how to demonstrate that and how to demonstrate that I had kept my clinical knowledge and skills up to date. Once board certified, I was really happy to see that the CEs required by BPS to maintain my certification were really a lot more useful than the CE programs that I had been doing to renew my state licensure every few years. And in my role, I conduct clinical authorization reviews for medications across various disease states. So staying current with treatment guidelines and first line treatment recommendations is really crucial. I found that the CEs required for maintaining board certification provided a really good, solid refresher on important disease states and clinical topics, and it was really helpful to me. I'm someone who wears a lot of hats professionally. I teach, I have a service based position, and we do a lot of grant based work. So I'm really grateful that the time that I spend on these courses is always time well spent, as increasing my clinical knowledge just really helps me do my job, and more importantly, it helps me do it better. As director of a team of pharmacists, my staff relies on me to provide guidance on complex clinical decisions. The education that I get through my board certification and my maintenance of my board certification really not only supports my success, but it supports my team's success. Pursuing board certification has been one of the most rewarding decisions of my career. It not only strengthened my clinical expertise, but it also opened doors to leadership roles, to teaching opportunities, and to meaningful public health initiatives. So, for any pharmacist who's feeling stagnant or uncertain about the next step, board certification can be a powerful way to reignite your passion, to enhance your credibility, and to position yourself for new opportunities. Our profession is constantly evolving, and staying at the forefront of clinical knowledge is essential, not just for personal growth, but for the patients and the communities that we serve. And that's my story.